radiological views of the temporal bone. Firstly, looking at the Lawes view. So this is a 15-degree cephalocaudal and the external auditory canal, this superior imposed on the internal auditory canal. Next, the mastoid air cells, the tegmen and the lateral sinus plates, the TMJ, that is a temporomandibular joint. Next, looking at the Schuler's view, it is the X-ray beam is at the 30 degrees cephalocaudal and the antrum and the upper part of the attic, that is the key area. Then the EAC is superimposed on the internal canal and the mastoid air cells, the tegmen and the lateral sinus plate, the condyle of the mandible and the sinodural angle. Next, we look at the Stenvers view. So here the X-ray beam, it passes between the optic and the EAC caudal, and the entire Pitras pyramid, the arcuate eminence, the internal auditory meatus, next the labyrinth with its vestibule, the cochlea as well as the mastoid antrum. Next, moving on to the Townes view. So here it's AP, that's anteroposterior, 30 degree tilt, and this is from above and in front. There is the arcuate eminence and the superior semicircular canal, the mastoid antrum, the internal auditory canal, tympanic cavity, cochlear, EAC, acoustic neuroma, and the apical petrositis. Transorbital view. So here it passes through the orbit, the internal acoustic auditory canal, the cochlea and the labyrinth, and the entire Petrus pyramid is projected through the orbit. Next, looking at the Stenvers view. So in Stenvers view, it is projected at right angle. This is to the film from the submental area, and the EAC and the mid-ear cleft, the mastoid cells, middle ear, the eustachian tube, the IAC, the sphenoidal cells, foramen ovale and spinosum, and the carotid canal.